And good morning, afternoon, evening, everyone. So welcome to our next WASH Canada Talks. And today it's our great pleasure. We're going to shift gears again and not just disciplines. I think we had engineering and then we went into geography, and we're still in a very, let's just say, academic setting and framework. And I think part of the strengths of WASH in Canada is also we have quite a few strong NGOs that are doing this. And that's what I was super keen to have Julie Truelove from WaterAid Canada come to speak to us today. Thank you, Julie, for accepting the invite. And we look forward to everything you have to say.
Thanks. Thanks so much, Caetano, and thanks to Kelsey, and thanks for the invitation. I'm glad to have the discussion and join in these. I've been following since you started the WASH Canada Talk, so it's great to be here. So yeah, I'll start with maybe a little bit about my background. So I'm also, I guess, a geographer in a sense, because my undergrad was a Bachelor of Science in Physical Geography with some limnology, hydrology in there, but I was actually working with the Canadian Red Cross as a part-time payroll clerk when I was finishing university, and just happened to get fortunate to meet amazing people who really encouraged me. They knew what I was studying and were saying, you know, we don't have many water sanitation people. Watson people is what they would always call it at that time. And so that really encouraged me. And then I went back and did my master's with the Water Engineering Development Center at Loughborough University in the UK. And so WEDIC, as they call it, they have a program for distance learning. And so I did it all by distance learning because I was working at the time and the program is set up for that, for people working around the world. So it really worked well for me. And then worked for the Ryan's Well Foundation, a small NGO in Kemptville, Ontario, and did some consulting, and then landed with WaterAid in 2016. And so yeah, so that's kind of my journey, I guess, to get where I am now. And just for a little bit about what I would do on a day-to-day basis, you know, there's the exciting days where you have good conversations with colleagues, you're learning new things, seeing different programs. You know, if we're influencing on WASH and we can see that it's having an effect of some kind, then those are like the exciting good days. But there's also the keeping it real days, which can be a bit of a slog on grant proposals and funding, and really looking at how do we get WASH into the dialogues beyond just construction of taps and toilets, because WaterAid's work certainly, and WASH generally, is well beyond just construction of taps and toilets. And as the picture shows, no one wants to wear the poop suit at different conferences, but that's my colleague Tayo at Women Deliver in Vancouver in 2019. I don't remember who's in the poop suit, but it was not me, but that's part of the job sometimes.
Sorry,
yeah.
I need to ask a question. So
Sure.
WaterAid has a poop suit that you take to conferences?
WaterAid America actually owns the poop suit, but yes.
I love it.
Don't get any ideas, Caetano.
Yeah, our group needs a poop suit.
It's a good discussion starter, that's for sure, because people want the photo ops with it.
And you can select your friends immediately, right? If they don't come talk to you, yeah.
Yeah, exactly. So a bit about WaterAid. WaterAid started out of the water industry in the UK about 40 years ago, or more than that now. And we operate in about 34 countries now, 7 of those being donor countries, including Canada, and then the others being where we have country program teams delivering operations on the ground and working with governments and things like that. And so just in February, we launched the new WaterAid Global Strategy for 2022 to 2032. And this is based around 4 strategic aims and 4 approaches that are considered cross-cutting. So the aims are around universal services, universal WASH, WASH to improve public health, climate change resilience, financing, and then we look at those at local, national, global levels. And then the approaches really are across all of those areas around services, capacity and influencing, partnerships and alliances, evidence, innovation, and the critical piece of gender equality, which we do a lot of work in Canada around gender equality, which we'll talk about kind of through the slides as well. So for my examples though that I'm going to share, I'm going to focus mostly on the health and climate pieces, just because I think I feel best placed to speak to those, and some of the other things will come through more broadly and hopefully in the discussion as well. So WaterAid's always looked at how to reach everyone everywhere, and that aspect of universal wash. And so we're looking at it as an approach with services, that services capacity and influencing component. And so we really see that as influencing WASH policy with advocacy, but then also how do we make sure that the policy is actually being put into practice and holding duty bearers to account, because we know that that's a big challenge. We can have good policy on paper, but then is it actually happening, and how do we help it to actually happen? And so there's a lot around system strengthening, and that the WASH system, it's people, behaviors, institutions, all those components that make a WASH system work. So how do we strengthen all of that to reach scale and really make it sustainable over the long term? And that these are aspects of our work really at global level, national level, and subnational as well. And so here in Canada, it's a challenge sometimes in the WASH world. In Canada, there's not a standalone priority for WASH at Global Affairs Canada. So our priority then becomes to integrate WASH into the action areas of the feminist policy. And we've had some successes doing that, I think. There's a good paper which I can share in the resources, but we're looking at WASH as a pathway to gender equality. So how do we inform the evidence, making the case for WASH in these critical areas of nutrition, education, livelihoods, SRHR, that are really embedded in the feminist policy. So I think it's these are challenges that we have, but it's a big part of, it's the core of what WaterAid is working on. And the circles that you see to the right. So WaterAid is still focused on WASH for basic human needs. So it's water, sanitation, hygiene for basic human needs. And we know that that exists within the broader water sector. There's much, we know it's a much bigger sector, but we continue to focus on the human aspect, the basic human needs, and then, but understanding that we need to know that broader context in the ways that we work. So in terms of WASH and health, and sorry for the diagram because this is a working copy, so it's a little sketchy looking, but so WASH and health is a huge area of work. So I was trying to narrow it down into something that's a little more digestible, but WaterAid has 7 health pillars generally, because there's the broad health sector, but within the health sector, it tends to be quite disease specific in many ways. And so how do we embed WASH broadly in health, but then more specifically in these different areas? And so the pillars are SRHR, WASH in healthcare facilities, nutrition, neglected tropical diseases, cholera, immunization, and infection prevention and control. And arguably over the last 2 years of the pandemic, WASH in healthcare facilities and IPC have been really the prominent areas of our work. But underlying all of these is that leave no one behind, gender equity and inclusion lens, and embedding hygiene into public health, which is a core part of the new strategy as well. But then on top of that, now we have COVID and we have climate resilience. So increasingly, we're looking also at what is the intersection of climate and health, and what does that mean for WASH over the longer term. So we really look at, again, demonstrating the evidence of why WASH matters in health and why it matters in these disease-specific priorities, but also bringing a WASH voice into these spaces, because as we all know in our sectors, we tend to be quite distinct and separate, sometimes in silos, and bringing WASH into those spaces. And so we do that here in Canada as well. We have a seat, I guess you could say, on the CanWatch, the policy working group, the Canadian Network for Women and Children's Health. And also we join the nutrition working group. So we bring a WASH voice into those spaces, and that enables us to make sure that it's embedded in statements and positions and things like that for health. And also with Canada's, they hold consultations with Public Health Agency of Canada ahead of each World Health Assembly. So we can again embed WASH, we can share evidence with them, and it goes directly into Canada's statements sometimes. Sorry, I'm going to keep an eye on the time a little bit in case I ramble too much. Okay, so WASH in healthcare facilities, we'll dig into a few examples. This is a huge area of work. So this is really just very much a snapshot. Oh, there's Clarissa. Very much a snapshot of the work that is being done. And so we know that many healthcare facilities in the world do not have water, sanitation, and hygiene, and that speaks directly to quality of care and the dignity of patients and really the safety of healthcare workers, that we've seen all of that magnified through the pandemic, and really looking at what are those conditions that drive healthcare seeking behavior. So if a woman's going to give birth, if she's going to have to go to a healthcare facility where she might have to bring water or not have access to a toilet, then maybe she's going to choose to give birth at home, which can lead to other complications as well. So it's really part of what's driving healthcare behaviors. And so there's a critical role of advocacy around this. We've been part of the WASH in healthcare facilities resolution that was passed at WHA in 2019, and all of the following, what's all followed from that in terms of, there's the WASH Fit model from WHO, there's the 8 practical steps of WASH in healthcare facilities. So all of that is become part of WaterAid's work, and we also are able to influence that work. There is a new UN group of friends for WASH in healthcare facilities, and also it's part of WaterAid's collaboration plan with the WHO, which WaterAid Global has a relations status with WHO. And again, having that voice for WASH in the current pandemic preparedness and treaty discussions as well. So cholera is another area, another example. To me, this is really at the core of a lot of when you talk about universal access to WASH or lack of it, because it's a disease of inequality that we've known for 300 years or so, that WASH matters in prevention of cholera, and yet we've yet to achieve that. It's very much overshadowed. We have the pandemic, but yet people still die of cholera every year. And so it's a big part of WaterAid's work in terms of both influencing, because we hold the chair of the WASH working group within the Global Task Force for Cholera Control, which has brought a long-term sustainable WASH lens to this, alongside what is traditionally the emergency response to cholera outbreaks. And so it's really, through the cholera roadmap, they're really looking at bringing this more long-term prevention lens and where WASH fits in that agenda. And so WaterAid Bangladesh holds the chair of the WASH working group, and also WaterAid Zambia and WaterAid Nigeria all work closely on this area of work in their practice as well. And then, so hygiene behavior change, I think it's often an overlooked area of WASH when we talk about WASH, because we talk a lot about water and sanitation, but hygiene is really a critical element in really making the benefits of water and sanitation realized for people. And so it's come through more prominently through the pandemic with early public health recommendations around hand washing. And so although we're not a emergency response organization, we're sort of in unprecedented times. And so there was a rapid scale up of our hygiene behavior change work in 26 countries where we work. And so this included, hand washing at border points. There was a big program in East Africa around border crossings and transport hubs and public spaces. And also looking at the design of hand washing facilities in terms of, is something foot operated, so it limits hand contact, and also making sure that designs are inclusive and accessible for people with disabilities so that everyone is able to use them when they need it. I think importantly too, there's this moment that's catalyzed hygiene around hand washing and hygiene with the pandemic, but it can't end there. We have to look at ways of how to sustain this over time and not just have it be something that came about through the pandemic and it goes away. We need to empower change on that so it's sustained over time. And that's where some of the policy and advocacy work comes in terms of, there's the UNICEF Hand Hygiene for All initiative. WaterAid has our own Hygiene for Health global campaign. And again, it's that influencing voice for hygiene and WASH in pandemic preparedness and the treaty discussions that are happening. And I think just to add to, on hygiene behavior change in the new strategy, we're really looking at how to embed this further in existing and successful public health platforms. So there's a great program in Nepal that's embedded hygiene behavior change with the routine immunization system. And so when parents bring infants for their first 5 vaccinations, each visit they have hygiene behavior change training and kits and toolkits and things like that is really embedded in the system. And that's supposed to go scale up nationwide after being piloted and researched for a number of years now. But it's using those existing platforms to where can we embed hygiene. So I think just one more example on health from the Canada context, and because this is really, I'm proud of this example, I think, because it's in Canada and it was in lead up to Women Deliver. There was a long lead up of a year, 18 months, where civil society came together to look at how could Canada be looking at funding for SRHR. And we knew that WASH is part of that. We know that menstrual health and hygiene is part of that. And so we were part of those dialogues that led to what is known as the Thrive agenda in terms of budgeting for women's health, SRHR, and what all is encompassed in that agenda. And so that Thrive agenda became essentially Canada's $1.4 billion funding announcement at Women Deliver. And then it led to calls for proposals that followed. And we are really happy to see that WASH, and I think it was WASH and healthcare facilities specifically, got a mention in the calls for proposals, because honestly, that hadn't really happened before. And so we were quite excited about that. And after much, I think it's 3 years past now, but we actually have had some success in securing funding for menstrual health as part of SRHR. So we have the Her WASH program in Liberia, Sierra Leone, Burkina Faso, and Pakistan. And then just getting underway now is also the SHARE program that's led by Right to Play in Ghana, Mozambique, and Uganda. Our component is focused on menstrual health and hygiene and access to sanitation for girls. So I think we'll shift gears a little bit here. I think I'm going to hurry up a little bit, I think. So we're talking about climate. This is the climate components, and I can give you a few examples. And so we have this formal definition of climate resilient WASH that we're using, but this is a newer area of work generally for WaterAid. The health portfolio is much more developed, I think. Pardon me. But so this is a newer area of work that is really emerging fast, and it's a really important area because it, again, kind of underpins potentially all these other areas. And so this definition of climate resilient WASH we have, but then a colleague of mine always says climate resilient WASH is just good WASH. And so if we're doing everything well and doing things what we know is theoretically the right things that should make it sustainable, then it should also be climate resilient. And so part of that also is when we talk about resilience, is it resilience for who, or resilience to what, I think is the questions we're trying to get at. And so it's really our objective, again, is the resilience of people and people facing poverty and marginalization, and what are the impacts of climate change for them. And then how do we then make WASH services and behaviors resilient? So again, it's good WASH that's going to make them resilient. And the third objective there is something new for WaterAid, and I think I'm not sure it's fully formed yet, but it's where if we do have options for lower greenhouse gas service options, then that's something we need to consider in our programs, because where they're using diesel fuel for pumping and things like that, maybe there's other options that we can explore. And what you see there for the definition of water security, that's not new in WaterAid. WaterAid's been looking at water security in various ways for a very long time, but this is really the foundation, I think, of our climate resilient WASH work as well, because we again need to look at that broader view of water security when we then want to focus in on WASH. So this is an example of a multi-sectoral partnership. This is not sorry, the graphic looks a little bit blurry, I think. This is not WaterAid specific, but it's a partnership that WaterAid is part of. And we've hosted some of the task team through the WaterAid UK office. It was formally launched at COP26, but the Resilient Water Accelerator is aimed to enhance water security for 50 million people by 2030. And so this is where the policy and the advocacy is way out front. You know, it's been developed. There's engagement of African Development Bank, UK government and other governments now, some municipal governments. I think City of Maputo is part of it, and the World Resources Institute. But now we're moving into the operational phase where they've identified 4 to 5 countries that are poised to be part of the pilot countries for the Resilient Water Accelerator. So this will be something that's really interesting to see where it goes. And again, in Canada, we're part of the Climate Coalition, the C4D Climate for Development Coalition here in Canada. So again, we can bring the WASH voice to the table. We're not the only voice for water, but I think for WASH, we're close to the only voice there. So it's been interesting to see those connections. Looking again at that nexus of gender, WASH, and climate, and where that affects nutrition and food systems in Canada's priorities for development, and as well as linking with that broader water security picture and the proportion of investment that goes to adaptation to then ideally also proportionately increase investment in water related projects as well. And so we're starting to explore nature-based solutions. We don't know what that looks like for WASH yet. There's lots of evidence gaps there that we need to explore and see what that looks like, but it's certainly another area that we're looking at. So this is one example of a practical piece of work that we're working on, a concept with the East Africa region. And again, it's looking at the principles, what we've identified as the principles of climate resilient WASH, which are the 6 items around the circle. And then there's the FIEP, the feminist policy, the action areas for climate resilient gender responsive WASH that we've aligned with those action areas. There's the evidence and value of WASH and water through water security, and then the gender equality lens for voice and leadership. And where does that where does this come together? I guess the nexus approach, to use that word. So I think this integrated approaches that we're looking at across, whether it's climate and health and human rights-based approaches, gender equality, they're really interesting areas of work. And I think it brings a whole new conversation to the WASH world, really, but it's also really complex. They're all multi-sectoral kind of approaches, and like a One Health approach, as you can see in the diagram, is something we're looking at. But then how does it work in practice? It's some non-traditional partnerships, which are often complex to get going and keep going. And also really that people don't live in sectors. And so maybe as complex as this is, it's maybe more the reality of how people live and how economies work, where you're not in distinct sectors, you're looking at these more holistically. And I think things like One Health and strengthening that link from the water resource management side to the WASH sector, because in my experience, they're often quite distinct conversations, which I think really there's no reason for that in many ways now. I think it needs to come together more. And so that building back better and green recovery from the pandemic, all of these things really have shifted the conversation, I think, and maybe for the better, but it's also very complex opportunities that we need to look at. So, and lastly, I think this is last. I think as someone, working in a global federation, but sitting in Canada, I guess I see kind of different aspects of both the global WASH sector and maybe where there are gaps in Canada as well. And so I've always been struck by this idea of where do we bring Canada into the global WASH sector, but also where can we bring the global WASH sector sort of into the Canadian dialogues a little bit more, because I do feel like it's a gap there. Pardon me. So we know there's a strong domestic sector in Canada for water. This emerging Canada Water Agency, which I think has been talked about in these sessions as well. And also Canada's leadership for gender equality, which we know is also needed in the WASH sector. And so yet Canada is really not always present in these spaces of the global wash sector, whether it's Stockholm World Water Week or various, sanitation and water for all, just for some examples. Canada is not necessarily present in those spaces, but they could be. And maybe what can we do as a sector to encourage that? So that's something that's always been part of what's on my mind, I guess, between working in Canada, but being part of a global federation. And also we're acknowledging that Canada has not necessarily achieved its commitments for Indigenous communities in Canada, which we're having a dialogue later today on that as well. But there's some progress happening slowly. But then how could we amplify voices of Canada's expertise, but also bring in the global wash sector who are eager to look at various issues across the wash sector domestically, but also to leverage Canada's expertise as well. So I think, I think I'll stop there. There's just some other resources that we can share by email as well, but I think that's it. Thanks.